afternoon to all of you joining us today. It is a lovely afternoon. Today is excited to be here today and for joining us once again for a wonderful episode on the Real Talk Show. Well, welcome to the Real Talk Show once again, and today we are going to be talking about universal health coverage and how it affects adolescents and the young people. Now, last week we had a very interesting conversation and we were talking about leadership among us young people and the adolescents. Now, joining me are two experts, and this is Waiswa Kwanga, who is the Senior Technical Advisor and Coordinator at the Civil Society Engagement Mechanism system for Universal Health Coverage 2030, Secretariat Management Science for Health. And also, on the other hand, is a beautiful princess, I'd call her, Laura Philida, Advocacy and Communications Specialist at system for Universal Health Coverage 2030, Secretariat WACI Health. Now, we are going to be discussing health challenges that young people are facing, ways to improve their access to healthcare, progress, and obstacles in achieving universal health coverage. Now, we're going to start with myself, but before I say that, good afternoon, guys, and welcome to the Real Talk today.
Thank you. Thank you very much.
Thank you, Faith, and thank you, the team, for inviting us today.
You are welcome. I'm seeing Laura's smile is priceless, but Maiswa, you're so. What is it? Please give my people a smile. Give
I
my
just
people a
got out
smile,
of
please.
bed. That's the difference.
Very early in the US,
No,
right?
no, no, no. A smile should be natural. I mean, just smile it out.
Yeah,
You look
okay,
younger
great.
when you smile, by the way.
That's great.
Now, because you're not smiling, I want the people to see your teeth more. So I'm going to throw the first question to you. What is universal health coverage and why should young advocates get involved?
Thank you, everyone, and thanks for joining us today. Uh, Universal health coverage is a concept that is always presented as a technical term, but at the core, it is a very simple definition. It is the aspiration that all people can obtain the health services they need of good quality without suffering financial hardship. That's really the definition of uh, universal health coverage. You will see like the WHO definition is quite long, but if you really come down to the key components of that definition, there's three. One is all people, and the second one is about that they can obtain the services they need, and then the third piece is on uh, making sure that no one goes into poverty or faces financial hardship due to the cost of health services. So that's in a nutshell the definition of um, universal health coverage, and we abbreviate it as UHC. So you will hear us use the word UHC a lot because that's the short abbreviation for it. In terms of why that is that UHC is grounded in the values of human rights, that all people have the human right to health, that no one should be left behind. No one should fall into poverty or forego the care they need, or their kids suffer from not going to school simply because they had to pay a bill for health out of their pocket.
Wow.
And that good health lifts everyone and builds nations' economies.
Well, thank you so much, myself, for that great start of introduction. Now, just to our viewers, please feel free to drop in your comments and contribution. Remember, what we are talking about today is us basically wanting to, address a few things. And one of the things, or if the three things that we are focusing on today, is health challenges that the young people are facing, ways to improve their access to healthcare, and also progress and obstacles in achieving universal health coverage. So if you're watching, please feel free to drop in your comments and contributions and be part of this conversation. Now to the beautiful Princess Laura. What is the theme and focus of the 2024 Universal Health Coverage Day campaign?
Thank you, Faith, for the very kind introduction and for the question. So, yes, as you know, for a bit of context, so every year on the 12th of December, we mark UHC Day. It's really an opportunity to raise our voice on UHC, make some calls, and we're always having a campaign. And this year, the campaign was just launched last week. And the theme will health from the governments. So let me give you a bit more background on this, because this year we're not only having a campaign for visibility on UHC, because fortunately we had some commitments already through the SDGs, through the UN high-level meetings on UHC, where leaders committed to prioritize UHC in the country policies. So there is still a lot to do to make sure that this happens. But now we want to ensure that while people and government prioritize UHC, that they also ensure that people are not driven into poverty by out-of-pocket payments when accessing health services. Just to give you a few figures on that, but there is like 4.5 billion people that still lack access to health services. And over the past 20 years, like financial protection has worsened. Like 2 billion people face financial hardship, and sometimes, and we have a lot of colleagues who face that, a lot of civil society report this. When you have to choose between having something to eat at the table and paying for health services, this is not the right way to ensure health for all. So yes, this year we really want to focus on ensuring financial protection within UHC.
Well, great. When you talk about financial protection and obviously having the people's interest at heart, it takes me to the next question for you, Laura. What planned activities are we expecting from the campaign?
Sure, thank you, Faith. So, as we were just saying, so this is a campaign. Usually, we have social media to make it visible. We have some videos, but this year is also about making sure that governments, head of state, Ministry of Finance, Ministry of Health, really move to action. And so that's why the main and major activity we would like people and young people to engage is sending out a letter to the policy decision makers to make sure that this happen. So we have the letter available in French, in English, in Spanish, in Russian. We're also welcoming any translation of it, which is a template. And you can go also on the UHC Day website and adapt it to your context. We have a few tools when you have like key figures, depending on the country, on where UHC is, what progress are we making, what kind of obstacle we are facing, this kind of thing. So it would be wonderful to have you engage in that. And if you want more information, we'll have a specific youth workshop. I think it's next week on the 17th. To go through it, so we can all, make your different letter together. You come a bit prepared with some of your key asks, and then we can prepare this letter together, and then you can send it out to your government. And by doing so, you will be in list to be among the UHC Day Champions campaign, which feature like the main UHC Day champions and give some visibility to your work. So that would be wonderful to make sure that everyone is in the loop. So we'll drop the link in the chats, and please join us also on the 17th. Oh, Face, I think you're on mute.
Oh, sorry. We appreciate the invitation and we look forward to hear what is going on in there. Now, building on what Laura just said on the contributions and what we're expecting from, the planned activities, it gets me back to you, Waiswa. How can young people meaningfully engage and contribute to the 2024 UHC Day campaign, knowing for the fact that I think they are the largest number of people who are meant to contribute and just benefit from the UHC?
Yeah, this builds off the first part of the second part of the first question you asked me, which was about why is it important? Why is the UHC, or why should young advocates get involved? The UHC is about the future, and so uh, for young people to have the future that they want, they have to be engaged today because the future is theirs. It's not for people who are making decisions right now. And so you want to make sure that as decisions are being made now, that you have a voice on it because it's going to impact you a few years from now. Now, in order to do that, UHC Day gives you a moment, gives all of us a moment around the world to say, let's stop for a moment and think about what is happening in our own context, in our own countries. And so, as Laura shared, the theme this year is on financial protection, people not facing financial hardship when accessing care. So it's very important that young people mobilize and organize to have meetings with their government officials because the only institution we have or actor we have who can um, stop this problem, who can address this problem, is the government. Really, it's the only one we have that can do it at that scale. And so, make sure you organize meetings with your member of parliament, with your minister of health, with your local leaders to talk about not just the problem, but the potential solutions to address this problem. And then, second, you can we have those tools that Laura just outlined. The letters send it, social media engagement. You can also organize your own events in your own community and bring people together to discuss the way forward on this.
Laura, how can young people advocates effectively collaborate with the policymakers, healthcare professionals, and community leaders?
Yeah, I think this question is directly linked also to what my dear colleague Voiceover was saying. But yeah, it's really about well, sending if you have already existing contacts, which is possible. We know that during the workshop we did together, on which we will talk more about in Lusaka for the regional adolescent conference. There was some member of parliament that took contact with some of the of you there. So you can also leverage this contact, but you can also just send this letter or create some contact, which is not always easy, but we're here to help as much as we can, and just be you. Express your concern, express the issue you want to solve and address, how you can collaborate with them, as Waiswa was saying, engage in meeting, or even doing your own events, your participate in social media, raising awareness so they cannot ignore the problem anymore. And we know some of them are very willing to help. So I would say showing up is one of the key to engage.
Okay, now you've talked about showing up and you've also talked about young people getting involved in these discussions, and also you have the workshop that's coming up. Now, what skills or training do young advocates need to effectively advocate for UHC?
I'll respond to that in addition to what Laura just said. So there's
Laura
certain
said,
things,
okay.
that as advocates we need to be doing. One is really, and this responds to the first question as well, effective collaboration is building trusted relationships. Be a leader that the community trusts, that the decision makers trust, that healthcare professionals trust. When you go to them, you tell them there's a problem, that they will listen. And also making sure that you are focusing on the people and not yourself, not just yourself. So it's the power is in mobilizing your community and then collaborating with others for the good of that community. And that will make you a very, very effective advocate if you are always putting the voice, the needs of your community forward first. And to respond to your next question about the sort of training that young advocates need to be able to effectively advocate for UHC, there are many things and trainings and skills that you can go down and list, and it's endless. But the most critical, in my view, in advocacy, and this translates into a lot of other fields, which is that you want to be a good public speaker. And so uh, making sure that we are not all always extroverts, some are introverts, but if you're passionate about an issue, you can talk about it publicly. And so making sure that you're comfortable with talking to strangers, that you are willing to try it out, and until I used to be nervous on these meetings, whenever in the beginning of my career. But over time, I've become okay with talking about the issues publicly. And so really being comfortable with speaking in the public. It doesn't mean a big crowd, it can be in a meeting. Telling stories. Learn the art of telling stories. The stories will make people connect with the issue you're talking about much deeper, much faster than data. But you want to make sure that you have evidence on your side. So data is very important. Every story you tell, if you have data, it's even more powerful. So making sure that you learn how to use data, and that requires also having some really good research skills, making sure you familiarize yourself with the issues that you're working on, but beyond the basics, really making sure you dig deeper, find the data you need, find the evidence you need, find the stories you need, and go and talk about this very, very powerfully to your decision maker, to your policy maker. Those skills are priceless in advocacy. But there are many more. Maybe Laura, you have something you would like to add.
No, I think that's very powerful, and you really highlighted the fact that yeah, it's just crucial to like share also your stories if you're at ease with this, because sometimes you're not always in a position to do so. But that's very like something to bond with everyone, including policymakers, because they're also doing this job because they care, hopefully, for their people too. And so this is very key. I think moving forward, as I see that Faith probably has a connection issue, but I think this is a very good transition to the next question, which was like, are there success stories or model of youth-led UHC initiative that we can all learn from? And I can start on this question just by saying that we really believe that the youth platform is already like a great model of youth-led initiative. And we hope that, our partnership, which is strengthening as we speak, will also allow to see growing leaders for UHC advocacy, like young leaders for now, but future UHC leaders in global, regional, national platform. But maybe also I wanted to just share with you about like three different youth-led organizations with very close to my heart. We work with them very closely on UHC, and even though this year we want to really like push and strengthen youth engagement on UHC, we always included that in our previous campaign. For instance, last year we'd had a parliamentarian discussion between youth and parliamentarians on some issue, which was very, very relevant and exciting. We hope we'll be able to make it happen again. And on this call, we had another youth-led organization, which is IFMSA, the International Federation of Medical Students Association, which is like an independent organization of medical students around the world. So if you also like a medical student and want to be part of it, it could be a good way to engage and link it to what you're studying. But there is also other platform like the One Youth campaign. You can be an ambassador. They are a group of young volunteers who work to end extreme poverty and evitable disease like TB, malaria, and others. And they are acting throughout the world. And then to close on this example also, I'm also part of Wacky Health, and we are holding the AFNI youth cohorts. My colleague Gloria, who some of you have met her during the Rahai in Lusaka in July. She was co-chairing the events. She leads on Equip and Empower young advocates for health financing in Africa. And so it's like a 1-year program with a U cohort, and each time you learn new things. So I think there's many young successful platform already, and that strengthening the linkage are essential. So yes, we can't wait to also keep working with the youth platform. We have a very strong partnership, so we can rely on this. I don't see Faith joining Waiswa. Do you?
No.
Because if not, like it's great to have a conversation us two, because we're working together. So feel free to ask also any question in the comments, and hopefully Faith will be joining very soon. We have the questions, so should we maybe continue and talk a bit more about the events we organized together during the Rahai in Lusaka, how we partners with young people here, and the pre-webinar, not webinar, in-person event we did also just before the meeting. I don't know, Waiswa, if you want to jump on this, or if we
Yeah.
should
So
continue.
I mean, on the question around how the Rahai UHC workshop and the other side events that were held that week. And by the way, kudos to you all. You did an amazing job on this in the workshop throughout the entire um, uh, Indaba. But the way it ties into UHC Day is that workshop that we organized and had together uh, was meant to help people understand better about UHC Day, I mean UHC, and then look at the ways that they can influence their decision makers. And so we went through a number of things they can do, but really focusing on how do you map out a campaign. And UHC Day is a campaign. It is us highlighting the issue of um, financial hardship due to out-of-pocket spending on health. And so that's a campaign. And what really needs to happen now is to go back to the circle that we shared in that workshop, and look at what's the issue and write it out. In your country, it's financial hardship, but it might be framed different in your country. And then go out of that circle, look at who is the target you want to target on this issue, and then who are the allies outside of that circle that you want to work with, and prepare that for the next month and a half until UHC Day, and then you'll be good to go to meet with your decision makers, with your community leaders, to make sure that you bring this issue to them well researched, well prepared, and ready to go. So I think that that's how kind of all ties together. It's a continuum. It's not a just a one-off thing that we did that has no connection to what is happening now. So that's how I would say that all tie together. Anything else, Laura, that you want to add to that?
That's great. It was just such an exciting event. You guys managed to put this together so quickly. There was like over, I think, 600 youth advocates during the larger events. So it was so great to see the energy there. You were even able to convey some member of parliament, some great artists there. So it was just great. We had fun. We could also just meet each other in person, which is so different. And start also creating more, channels to communicate. We now have a WhatsApp group with some of you who were very interested in UHC. If there's some also on this chat that want to join, please feel free to let us know. But we also like communicating a lot more, and hopefully we'll be able to move forward on this partnership. So that make us move to the next question. Actually, I don't know, Waiswa, if you want to add anything. We
Yeah,
lost.
just one point that for those side events we had, that was a moment to build a relationship of already, we had a lot of connections with these MPs that were present and other government officials that attended that Raha. But and this UHC day is what we're asking is that you take to the next level now. You presented the issues. One of them was on access to contraceptives that weren't being offered in some spaces because the program that the government established was not really accepted by private providers, at least not all the time. And so you want to take that issue as an example of how somebody would suffer financial hardship, even more problem than that, if the government and the private sector continue to work that way, where they say there's a service, but then you go there and you deny that service because you are not paying out of pocket using a government program. And you are using a government program because you don't have a lot of money to spend on healthcare. And they're denying you an essential health service. So making sure that you make those connections this UHC there will be great. Um, and so, for me, the key, because one of the takeaways I got from that, uh, from the Raha was, and that we can inform the UHC today, is that numbers matter, that we are more powerful when we come together, when there's more of us, than when we're working alone. I felt I was part of a community. I felt I was part of not just a community, but a very strong,
Mhm.
powerful, passionate
Yes.
community of young people. And that's the source of our power in advocacy. Take that energy, take that inspiration, and apply it to the campaign for UHC Day, and we'll make progress.
That's wonderful. Yeah. This is really like all about the energy you all have and making sure that it's not, does not fall into the crack, and just that you keep the momentum going. And we couldn't be so active without you guys. Like your commitment, your engagement, you already, we say young advocates to create this community sense, but you have already so much experience. So you feel confidence in like how you move into the world to ask for what you want in health or other sectors. I felt that I was part of the One Youth campaign when I was a student, and that really helped me, like bringing a foot into the health space area. But we all have like capacity in advocacy already, through like our own stories that we're ready to share or not. So that's really something we felt during this event. So we're glad we're continuing this partnership. And yes, it's less fun without Faith. Like she brings also so much dynamic in that. So I hope she'll be back soon. But we can maybe go and move forward towards another area, which was on action and accountability. Waiswa, do you want to share more on, what concrete actions young advocates can take to hold leaders accountable for UHC commitments, even though we talked already a bit about this?
Yeah, so I would say one is, um, so we know that in a democracy, the best way to hold a leader accountable is during elections. And so continuing to leverage whenever there's an opportunity for elections, to make sure that you hold your leaders accountable when they come to look for your vote. Usually they get in the office and they forget. Oh, sometimes they get just too busy. But when they come back to campaign, it's the opportunity to say, wait a minute, you promised this, you didn't do it. That's one way to hold a leader accountable. The other way is, you organize a meeting with your policymaker, and then you go home, and that's not going to help you. You want to actually make sure that you are following up, that you don't stop going back to them because they're busy, and sometimes they forget about these things, or they're just too busy. They think about them, but they just don't have the time to work on them. But if you keep knocking on the door, they will know that they're accountable to you, and they will respond because you show up. And then I would say that, when some of these traditional message methods of holding leaders are accountable are not working, like following up and nobody's responding, or the elections and you are not winning, you can always take this to the next level where you can publish an op-ed, a letter to the editor about something that is important to you that maybe a leader is not delivering on. And you have to be careful to not like humiliate them, but you want to make sure that they know that they are accountable and answerable to certain segment of their constituency that needs something. So I would say that those can be some ways that you can strengthen accountability with your leaders. But there are many other ways you can do that.
And if I may add before we finish on this question, Waiswa, but on like when you send this letter, for example, for UHC Day, Waiswa was talking about like publishing an op-ed to make noise. And this is also a good technique to publish something and make noise on social media, something saying we send out this letter to you choose if you want to name the people or just quote the title of this person. We now looking forward for an answer to move forward to address this issue. Again, not something aggressive, just so people also know that there is some action that you have been taken on this matter. And that's also a way for politics to be more pressured, in a sense, to respond to your letter. If people out there know that you have reached out to them, it's giving them, okay, there's some stake in terms of visibility here and reputation. So maybe we'll answer a bit quickly than usual. Yeah, just a tips that sometimes works for some advocacy work. And I don't know if Faith is back. Faith, we miss you. Can you hear us? Oh, I see your name, but I don't see her smiley face. Okay, no, she disappeared again. Well, we hope she will be back soon. We have a last question to conclude on this one is how can we really measure progress and evaluate the impact of youth-led UHC advocacy efforts? Which is like something, a question that we have for overall work, not only for youth, engagement, but for progress on UHC in a whole. Waiswa, I don't know if you want to start answering this one.
Well, I would say that so the evaluating and measuring progress in advocacy is very challenging, but there are steps that you can take to see how uh, what impact you're having. One could be short term, another sort of like intermediate time, and then you can look at it long term. Advocacy is not like relying on one single event
Oh, Waiswa, can you hear us?
Yes, I can hear you.
Now
Yeah.
we can. I can hear you. For
Yeah.
a minute, I was afraid to be alone in this show,
Oh,
talking
okay.
to myself. Thank
Yeah.
you.
So advocacy is a long-term game, and you have to have the heart and the patience to wait for the result sometimes. So, it's not something you expect to get in it's a few months or even in a year or even in a few years. But you want to look at these small steps that are being made along the way, and don't ignore those. If you wrote a letter and to your member of parliament or to your minister of health and they responded, that's huge. That's a good step toward you getting the message that you want to them and then them to act. If you held a meeting and you realize that the person you're talking to, the decision maker, actually takes this issue seriously and is making some level of commitment to it, that's a win. It's a very short-term win, at least for you've built a relationship. Sometimes it's building a relationship is a win itself. So you have to look at this over time and see how then they translate into the big thing you're looking for. Nobody is going to just say, they came to me today, I'm going to pass a budget that is twice as big as the previous one because they came to me. It's not going to happen that way. It doesn't happen that way. But they will get there over time because there's so many priorities that government officials are dealing with. It's not just this one issue. It's not like they don't care sometimes. It's that you have a small budget and you're trying to fit in as many things as you can. But you are going to increase slowly over time because you're hearing the message and you care about the issue. So I would say that you want to measure the short term, the intermediate, and the long term to see your impact. But always make sure there's something going on in your advocacy.
Thanks,
Hi
Moisa. What
guys.
can I say? Yeah.
Hi guys. I'm sorry I abandoned you for a little while. I don't even know what I have missed and what I haven't.
Oh,
But
good. Yeah.
all right.
Yes.
So
We
have we
just
talked
finished the
about?
question, Faith. I
You
think.
finished all the questions.
Yeah, I think we were at the last one on how can we measure progress and evaluate the impact of youth-led UHC advocacy effort, which I think was the last one we had on our list. But if you have other, feel
Oh,
free.
okay. I have two more. I have two more
Oh,
for you. You said you took the one for how can we ensure the long-term sustainability. You've done that one already.
yes.
Okay. Concrete actions in young people.
Also, yes.
Okay. There's one that I saw for how can the UHC expand in terms of advocacy on social media? Did you tackle that one?
We can talk a bit more about this one before closing for sure. I think it was all across our question, but so, as them, we are engaged on some platform like Twitter, and UHC 2030 is engaged on LinkedIn also. But we not engage in many other social media platform. And we saw when we were at the Rahai that you were engaged in so many things. And I think one of the highlight of that is that social media are good for it's a good space to raise your voice in there. And sometimes we feel we missed a bit the opportunity to do this. And as a group, we can be very powerful, but the more voices we have, the better. So to make noise, but also to ensure that action are taken, which can be a good way. If you publish something on Twitter, on LinkedIn, or any other network like Instagram, and you tag us when you can, we will make sure to amplify that and make sure just, raise the action you're doing, participate within social media on UHC Day campaign is actually one of the faster way to participate. Some of the messages are already available. You can tweak them, personalize them. We have also visual, but we also know that we ask a lot young people to be working on social media. I think that is a call for everyone, not for young people especially, because you also have your own work. But just to let you know that it's there. We're always open to any feedback on this. So. And this is thanks to social media that we're having this discussion today, because we live on Facebook, we live on YouTube, on LinkedIn. So that's very a place we need to be even more present. So thank you for your huge support in this. Faith, we can't hear your beautiful voice. You mute.
Sorry. Yeah. Before I could let you go, just on the point of social media, maybe it would be interesting for the young people to know if they were to want to learn more about the universal health coverage. What are the platforms that you are on, and how can they access you guys on the social media?
Sure. So the best way is to follow us on Twitter. It's C. So it's an acronym for Civil Society Organization for UHC. So it's CSOS for like the number UHC. This is the best platform. You can have a lot of information, and you can also follow UHC 2030 on LinkedIn. And then we post blogs on our website, and maybe there is a way to follow also information by email, or I'll try to put that in the chats. And finally, if
Okay.
you want more information, don't forget to register to the webinar on the 17th of October next week. We'll talk more about
And
all
to
of it.
join the group we created, right, for this particular
Oh yes, there is a
on
WhatsApp
WhatsApp.
group also that
Great.
you can join. So if there is any people interesting, just drop, well, maybe not drop your number on the public chat, right? But we'll manage to find a way for giving the link for that for
Okay.
you to join.
Oh, great. I guess our viewers took note of that, and really, with the interest of what we have, most of the people would be interested. We can just read a few comments that we have before we finally get to say our bye-byes. All right, so Crispin Mwembala is saying, I'm following from Chongwe. Thank you so much. This is in Lusaka. We appreciate watching from Sesheke. Thank you so much, Dixon. We appreciate you following. Lisa Zoe Lubinda is saying, watching from Livingston, all the way from Southern Province. We appreciate you, Lisa. Watching from Sesheke, Palisa. We appreciate you. Thank you so much. All right. Moyambango says, this is powerful conversation. UHC following from Choma. Thank you so much, Choma Mano. We appreciate you. Well, those were the comments that we have. We just want to appreciate all our viewers that followed us today, and I hope that you enjoyed the conversation, regardless of what was happening, but just get out the important information. And also remember, this conversation was all about us addressing the health challenges facing young people, ways to improve their access to health care, progress and obstacles in achieving universal health coverage. And if you have more questions on this, if at all what was shared today was little for your understanding, please feel free to follow, as Laura has mentioned, on their social media platforms, and just get more insight on what you want to be answered. With that said, Laura and Waiswa, any last words before I could start finally close up the show?
Just a huge thank you for the invites, and that we keep each other posted, we stay in touch, and we're very, very happy to be working with you all.
Well, thank you so much, Laura. Waiswa.
Just to
It would be
say
nice
that,
if you smiled as you're saying bye. At least you entered with a serious
well,
face. You
I
can leave
have a
with a
beard.
smiley
When you
face.
have a beard, sometimes it hides the smile. Um,
Oh.
just to um, just to say that we're excited about your engagement this UHC day, and really looking forward to your support and making sure that we all work together to address this major problem of financial hardship due to access, out of pocket spending on health, essential health services. Not just even, we're not even talking about cancer, we're talking about people needing very essential basic care, and they have to go into poverty in order to choose to eat or not to eat because of a healthcare bill. And so we're excited about your engagement, and we're very appreciative of the youth platform, and we'll continue to be engaged. I want to say that yes, we can make this happen, and yes, we can change the policies, and yes, we can make change. Thank you.
Well, thank you so much, guys, for having honored the invitation. We're glad to have you on the show, and I'm sure the young people are so excited to learn that the universal health coverage is here with their interest at heart. And I think it's one of the greatest things that anybody could ask for: safety to health and quality access to medical care. And like I always say, health is wealth. So first it's health, even before you start running about doing your 99 jobs. So thank you so much, guys, for having joined us. I've been your host, Faith Malambo, and thank you to our guests, Laura and Waiswa, not forgetting my beautiful sign language interpreter, Memory Zulu. On behalf of the entire TYP and Real Talk production, it's bye bye, and see you next week at the same time.
Thank you. Bye.
Bye.